Hello and welcome. This is Chaiti Narula, and today we're discussing a very important topic, viewers, which is largely a taboo in our society in India and still around the world, even in developing nations. We're talking about mental health, and the World Health Organization has dropped a latest report which turns out to be the largest report on world mental health since the turn of the century. There could not be a bigger report than this, and this report that I'm holding in my hand right now is a call to action to transform mental health. It will come out in public domain, which is supposed to be the largest since the turn of century. This is the WHO literally coming out and telling all stakeholders, call to action, do something about it. Not enough is being done about mental health, and they are not just talking off the cuff. Just look at the facts that they've come up with. In 2019, they say nearly 1 billion people, including 14% of world's adolescents, were living with a mental disorder. People with severe mental health conditions die on an average 10 to 20 years earlier than the general population, mostly because of preventable physical diseases. Depression and anxiety has gone up more than 25% in the first year of the pandemic alone, and these are just few of the many facts that they've highlighted. So here, this is urging people like you, mental health advocates, people who are in the ecosystem, to do more. Where is it that India is falling short, Dr. Parekh?
So I think the word is falling short would be a fair way to look at it, and not really India. And that's why the WHO report. And like I said, it's a timely report. COVID has exposed what was already there. There was not just an elephant, tons and tons and tons of vision that could have been there for all of us to see, but we didn't see. It was there. This data that we talk about right now was there earlier as well. But somehow we were not able to prioritize mental health. Here now WHO is saying very clearly, the nature of problem, the sheer extent of problem, the impact of problem. Now we know that. Now, when we talk specifically about India, what are our problems? Our problem obviously is that we have a population. We have the sheer length and breadth of our country is huge. So we have shortage of experts, and these experts are disproportionately present a lot more in urban India. Now, this is the fact. So for us, it is about how do we do the last mile connectedness, the outreach, so that we can bridge the gap, which is becoming lesser in urban cities, but a lot more as we go farther down.
That is exactly, the big question. Dr. Parekh, I know you run one of the biggest mental health advocacy and mentorship programs in the country. I mean, where are the more people like you joining forces, joining hands to even take this to tier 2, tier 3 rural India where this is still required?
So I think some of it has started happening. I think the fact that telehealth was introduced and continues to be one of the key factors for mental health. The fact that in the budget, Honorable Finance Minister talked about mental health. Now they are setting up nodal centers, about which I'm sure Dr. Bhavu will be able to better tell. Yes. But what we are doing here is that by ensuring that you take advantage of the digital reach, you create an affordable outreach for people. And this is a doable thing. So what you need to do is, if you bridge the gap at the primary health center level, you utilize your Anganwadi worker resources. You go at the Gram Panchayat level, you go at the district level, do some training, give the digital services through public-private partnership, through strengthening government systems, and what you do is you make experts available. All the advocacy and all the awareness that we can do, if we don't give access, then advocacy becomes meaningless. Once the access happens and people are able to experience the benefit, that will change the stigma completely.
Absolutely. So you speak of access. Dr. Garg, where is the access today in India, while even the urban metropolitan cities are struggling with access, with affordability, when it comes to counseling, when it comes to so many things, when it even comes to coming out and speaking about what they're going through? I just cannot even imagine what the rest of the country is facing. So what are the psychiatrists and the associations, hospitals around the country doing to make this accessible and enhance the last mile connectivity when it comes to mental health?
See, the access to mental health care is a major issue. We have issues of access to mental health care, the gap in mental health care because of the shortage of qualified mental health professionals, skilled mental health professionals, be it psychiatrists, be it psychologists, be it social workers, be it mental health nurses. The trained manpower is still grossly lacking. We have numbers of less than one psychiatrist per lakh population across the country. The second reason for lack of access is the unequal distribution of the providers. As Dr. Parikh mentioned, that the metro cities, the urban centers, they do have psychiatrists, although the numbers they are also lacking. The remote areas, the rural areas, the number of psychiatrists, the mental health professionals is abysmally low. So that's a major reason for lack of the lack of access and lack of accessibility to health services. Another important reason, I think, is the stigma of mental health issues. Even the services may be accessible, the people are not willing to accept those services. About the
Your voice is breaking. I'm just going to request the producer to establish your connection. Dr. Garg, meanwhile, Dr. Sameer Parikh, if you can hear me, let's talk about policies. The World Health Organization has pressed upon how policies needs to change. It speaks about transformation of policy and practice in mental health that can deliver real substantive benefits for individuals, for communities and countries everywhere. What kind of a change in policy would you like to see in India, and how can that be achievable?
I think we need to look at policy here from two angles. One is policy that comes through government channels, and one is, I think, policy that has to come through private channels. And I want to first talk about private here, because somehow for most of our problems we just want the government to give us solutions. So let's look at the private sector. I'll start with healthcare providers. Healthcare providers need to integrate mental health programs across primary, secondary and tertiary healthcare, which right now also in the private sector is not as established and comprehensive as it should be. And they need to bridge in the psychology and health gap. So for example, in chronic care, cancer, trauma, amongst others, integration of psychological services. Similarly, the psychiatric community needs to focus a lot more on community awareness because we need to break the stigma. Now let's come to the corporate sector. It's not merely the CSR, although I do feel a lot more CSR needs to reach mental health. It's also the kind of policies that a corporate environment has. So the leadership needs to be committed, needs to have evidence-based policies and practices which promote well-being and which reduce stigma. And corporate sector needs to integrate mental health end-to-end, where their employees can reach out to an expert whose accessibility is provided by the organization and funding is provided by the organization to make it affordable. Similarly, at other community levels, at school, you integrate mental health curriculum, you bring life skills training, and then at community level, you work on psychological first aid and continue to work to strengthen community-based practices, family, friends, RWS support systems. All of this needs to come together, and advocates like yourself, celebrities in the media, everybody needs to continuously talk about mental health in the positive way, and portrayal of mental health in entertainment media needs to be done with responsibility and sensitivity. You put all of this together, and then yes, the government needs to ensure that insurance sector enters mental health very significantly, not just in the IPD level, but also in the OPD level, to give us a national suicide prevention policy, and yes, to strengthen telemental health. They've already done a lot of good steps here, but I think a lot more needs to be done to speed the process and ensure that more and more public-private partnerships happen so that the experts who are largely in the private sector, their services can be utilized by the government as well to ensure an outreach. You put all of this together, that is the way forward for our country.
Dr. Garg, I'd like to bring you in. Dr. Sameer Parikh just mentioned about change of policies in the workplace as well. Corporate India today, is India incorporated outside of speaking about mental health care initiatives in the 2% of the CSR activities, really imbibing that culture in offices? Can today employability be hampered when an employee comes to human resources and says, hey, look, I'm having issues with sleep disorder, or my anxiety levels are shooting off the roof, or I need counseling with A, B, or C? They are somewhere not being taken seriously, and that becomes a deterrent for their progress even today in India incorporated. Dr. Garg.
Yes. So, in terms of awareness activities, the all the corporate organizations, they are organizing workshops, they are organizing visits by the psychiatrists, mental health professionals to talk about mental health issues, identify recognizing mental health issues. On paper, they are saying that they will not discriminate, but the reality is that when an employee actually approaches that I have this issue, they are discriminated against, right? And everyone thinks, will he or she be able to do this job? How will we provide the mental health services? How will their efficiency be hampered by their mental health issue? I think even now, no one takes leave we all take leave because of common cold or fever. But I don't think anyone takes leave because I'm not feeling well today because I'm a bit depressed, I'm a bit stressed. That's not the reason for any of the leave applications. Even in today's world, we may say that we are all very sensitive to mental health issues, but the reality is when our patients approach us, they are hesitant in discussing their issues. They don't want a document. In fact, they would approach some other physician for a document for leave. They'll put that medical issue as the reason for leave rather than a mental health issue.
Dr. Garg, that is so sad. I mean, I understand I'm in a highly pressured environment and I work in news, but I know many others in the corporate sector who will not be able to call up their bosses and say, hey, listen, I have a flare-up of my anxiety, or, I'm just feeling a certain way mentally, feeling not okay, and could I take the day off work? Will have to end up faking a physical disease without even realizing that the mind is as much a part of the body as any other part of the body.
And not only the corporates, I even say that within the medical sector, the doctors, our residents, our undergraduate MBA students, our doctor colleagues, they are also not comfortable discussing about the mental health issues. They will not use this as a reason for not coming to work or asking for time off. Even within our psychiatric departments, people will not be forthcoming with their mental health issues as they would about their physical issues. So that's the reality. And the day we are able to tackle this issue, I think will be able to manage our workforce very well.
Well, I would say India Incorporated is a slightly far cry. Let's talk about the healthcare sector itself. Dr. Parikh, after COVID, we know the stress levels in doctors themselves who were in the front line treating the COVID patients. Are we going to sit here and imagine that they never faced any kind of mental health issues? And in case they did, is the healthcare sector doing enough for them as well to cope with this?
I think the healthcare sector is doing, but it's doing within their own silhouettes and not necessarily as a comprehensive across the board. So the organization from where I come, we actually have marked entire year where continuously we are going to focus upon mental health of our workforce.
That is because you are present there. That is because you are present in running the biggest care program over there. But what about other hospitals?
Correct. So, but the reason why we are doing it is because our leadership recognizes it and wants to invest into taking care of our own. So whether it was during COVID and how we provided for care from nursing staff to our doctors, or now, or what we planned for the year. But like I said, all this is happening by individual providers. This needs to become more at bodies like medical bodies need to ensure that all healthcare providers start doing mental health support work for healthcare workers. And here I also want to focus not just doctors, especially the nursing staff, because somehow we don't realize that the backbone of healthcare is essentially what the nursing staff, teams do. And I think that's something that has to be the way forward.
Right. Dr. Garg, let's speak a little about children as well. Where are the policies today in terms of having the right kind of counseling and psychiatric help in schools, colleges, educational institutions? Is that also amiss in India? And what do the lawmakers really need to do according to you on that front? Because here, this report is clearly a call to action. If we don't discuss this today, I don't know when we will.
Right. So, in fact, just before the program began, I was discussing with Dr. Parikh that this report, Fortis runs a very strong program on anti-bullying in schools, and this WHO report it actually recognizes bullying as one of the leading risk factors
the report says childhood sexual abuse, I'm quoting, childhood sexual abuse and bullying victimization are major causes of depression, quote unquote, from this report as well.
Exactly.
And that major bullying happens in schools and colleges.
Exactly. And the only way to manage this is a strong mental health support network in the children and adolescents, which can be, I think, best delivered through schools, because that is the main central point where you can actually capture the children and adolescents. What people are doing about it, I think it depends from state to state. Some of the state boards, some of the state educational policies which are strengthened, they do recognize the need for a counselor in most of the schools. I think in Delhi schools, most of the schools do have a counselor, designated counselor. But
are they effective? Are they even effective?
Yeah, that's what I was coming to. Even there, how qualified they are, how skilled they are, and how much they are able to tackle the issues, and more importantly, are they able to refer when referral is needed? So that is something which needs to be worked upon, and we're talking about Delhi right now, but what's actually happening in other states, we are not even sure about that.
Yeah, exactly, and hence the transformative policy at the national level needs to come in. How would you urge, Dr. Parikh, the lawmakers to really draft a policy that goes across the entire spectrum?
So let me start with schools here. Just 2 or 3 things if we do, we'll be able to make an impact over the next 5 to 7 years. One, make mental health curriculum mandatory.
That's very
So mental health curriculum essentially is training teachers into mental health. We've written a mental health curriculum. It's already written in 2 languages. The next translations are actually also happening. That's one. Second, we also need to start designating teacher counselors who have the skill set and the inclination to provide basic counseling and give them basic counseling training, because we do not have adequate number of counselors. Having 1 or 2 counselors between 3,000 to 5,000 children is not going to work in any case. So you do that. This is where you bring in psychological first aid, where you make sure that the first contact is done in a way that it helps people take help. The third aspect, like Babu was talking about and you were talking about bullying, the only way forward is life skills. You have to train children in life skills. So assertiveness helps with bullying management, communication helps with bullying management, help-seeking behavior is a part of it, problem-solving behavior, creativity, you instill. That's what needs to happen at a school level, and all schools need to have mental health programs available, accessible easily, and parents should be also aware that, okay, this is where I can go if I have a problem.
Parikh, I want to play devil's advocate here because I have to. I'll tell you, every school that has mental health practitioners, I'm not saying they're bad or ineffective or inefficient. I'm sure there are tons of schools who are doing this the correct way with the right qualified practitioners. I'll give you my example. Many years ago when I was in school, we used to have a counselor who, students used to go to the counselor, and the counselor used to say, we were in a convent school, there's a chapel right there in the school, go and pray and all your problems will be fine. So if that is your answer, to every student coming and telling you that this is the problem I'm facing or these are the stress levels. So that means that there is some lack of qualification right there, and ensuring that qualification also becomes a must for the schools, right?
No, agreed. In fact, that's what Bhavuk was also saying, that we need to look at that. But I think largely the Mental Health Act is also helping in clearing this. They're defining it well. They're also talking about the nature of work that you do and the nature of record maintenance that needs to happen. All that is actually happening in process. I just feel that private sector, whether it is in education, whether it is in the corporate sector, whether it is in healthcare, private sector also needs to really walk the talk with major intent on the issue of mental health. I just feel that that's where the problem is. And that's why, so let's say when the government says we'll open 12 centers, nodal centers across the country, start telehealth, private sector needs to also double it, triple it. Corporate India needs to say, okay, each organization can take care of mental health of their employees. Not very tough. You give pre-employment checkups, you give annual checkups, you do vaccinations. It's not tough to provide for telehealth services, mental health services, and ensure that you pay for it, as in the organization funds it. These are the things which are required to make it affordable for the employees.
Absolutely. But what about the stigma that still exists in the private healthcare sector? Of course, conversations like these really take us a step closer to destigmatizing these conversations. And I'm so happy we at India Today are doing more shows like that on a continuous basis. But you know, somewhere still, while corporate sectors will posture themselves to recognize it, it will be a huge deterrent to their employees if they come out there and talk about it till date.
That's why it's about leadership. It's about the vision that percolates top down for every organization that needs to become affirmative, positive, empathetic, and responsible when it comes to mental health. It needs to happen in each room and each corner of our society. You having a cup of tea with friends, you are an advocate. Somebody else sitting with friends, you are an advocate. And be very clear, expertization of mental health is not a solution for a country like ours. We don't have enough experts. Advocacy to hit on the stigma and then using access, bringing it in an affordable way, timely intervention, and our community support system. Our strength lies in our support system. That's always been our strength as a society, as a country. We need to ensure that we utilize our support systems. Now, all of this needs to happen at one go and together, parallel. It can't be one after the other, because some of these things will take some more time, but things which are in our control, which is advocacy and talking about it positively, this is something we can do. And the more you have these conversations, the lesser would be the stigma.
Absolutely. And Dr. Garg, you know, I'm proud today as an Indian because we have decriminalized suicides in our country, but there are 20 countries around the world still that criminalize attempted suicide. What do you have to say about that?
I think the decriminalization of suicide, which took place, was a major step in tackling the stigma that was during suicide attempts.
Yeah.
Most of the suicidal attempts, they were, if in our country, the major, if you see, the major agency which reports about the suicidal attempts and suicides is the National Crime Records Bureau, because that was the central place where suicides were, all the suicidal attempts and suicidal deaths were reported, right? So, and that was a gross underreporting which was happening, because people knew that if I report this, some legal action may be taken against me or my family member. By decriminalization, and I'll tell you, we're working in a government sector where we see lots of suicidal attempts, and we have a police chowki in our center. So it has made a huge difference. People are reporting those things. It is being mentioned in the document that yes, this was a suicidal attempt. Because it has been mentioned in the suicidal attempt, a psychiatric referral is taken and that person is taken care of. Earlier, what used to happen, it was not reported as a suicidal attempt, it would not reach a qualified mental health professional, and the person, and to tell you the truth, most of the suicidal deaths are preventable if they are given timely intervention, if they are given support.
Oh, absolutely, well said.
This decriminalization has helped in that. Now these suicidal attempts are being reported as suicidal attempts, and accordingly appropriate care is being provided to them.
And people who are hearing it must know that if you are feeling suicidal, a lot of help is available. These two gentlemen in front of you, they exist, they run advocacy programs as well. Just Google it. Just Google suicide prevention helplines. I promise you 20 of the helplines will pop up, and help is always available. If you cannot afford private mental health care, you can always go to government health care, and that is also available in our country. So while we speak about suicide, I always make sure I speak about this caveat always. Dr. Garg, making available livelihood support for people with mental health conditions is another point that the WHO keeps stressing on. Is India at the governmental level doing that? If somebody is going through a condition which is just beyond anxiety, depression, that makes that person indisposed because of their mental health condition, is there livelihood support being provided in India?
See, there are initial steps have been taken, and we are, I think, going in the right direction. The Person with Disability Act was revised, and now we have the Rights of Persons with Disability Act. So that act recognizes mental health issues, both intellectual disabilities, specific learning disorders, autistic spectrum disorders, and mental illnesses as a qualified disability. And if you have a benchmark disability that is more than 40%, if that you are falling in that bracket, then there are certain provisions which are available, like disability pension, like reservation concession in railways, concession in your different slab for your income tax when you submit your income tax, right? And additionally, now there are certain reservations in educational institutions in various courses, as well as certain jobs as well. So yes, we are going in the right direction. In most of the places now, there is some percentage reserved for persons with mental health issues, mental illnesses. But we still have a long way to go, and I think the best still, even if they reach the place, the stigma hampers them from reaching their full potential. So ultimately, they find it difficult to cope up in that environment. So the next step that we need to do is provide them an enabling environment. In fact, that is the major way we look at managing persons with disability. It's not their fault. We have to modify our environment to suit their abilities. So we have to look at it this way. So I think that's the next step that we need to do. We have taken these steps for visual disabilities, for locomotor disabilities, for hearing disabilities. Now for mental health disabilities, we need to take these steps, and we need to provide them an enabling environment to reach their full potential.
Right. Dr. Sameer Parekh, what has been your observation since the point you started the advocacy program till today? Are you seeing some sort of tectonic shift in the attitudes, in the perceptions, in help-seeking behavior? Are families opening up far more than they ever did before? Has there been any kind of change? Because even a little change would mean that we're a step closer towards the end goal.
I think the honest answer here would be that change has happened. It's just that the nature of the problem has been so significant that even when we make a lot of change, it seems less because the problem is like a mountain. But yes, advocacy has helped. And a lot across social media, you will see lots of young people talking about mental health. You also see how some of role models of young people recently from, let's say, the field of sports have talked about their mental health. That has also had an impact. The more mental health conversations happen, it's going to make an impact. I feel social media has had a positive impact when it comes to awareness. Yes, it comes with its own negativity of cyberbullying and trolling, and also with incorrect information. And that's where we have to do our balance, which means we ensure that advocacy becomes an ownership for every individual. Something that I tell everybody, so I'll say here also, look at 1 in 5 to 6 people in the world will have a mental health illness. So how about 1 in every 5 to 6 social media posts that all of you listening today make one on mental health?
Yes.
6 selfies is fine, but how about 1 on mental health?
6 selfies, but 1 mental health post.
But one mental health. So you give me one post in every 6 or 7 posts, and that's the difference.
I have to say that Gen Z has become far more woke and discerning than millennials could ever be. And Gen Z, I'm sure you're listening into what Dr. Sameer Parekh is saying. If you make 4 or 5 posts with selfies of you partying on social media, how about putting out one out there for mental health awareness as well? It's a step in the right direction and will help us break taboos as well. Dr. Parekh, what is the message that you want to send out in terms of health-seeking behavior to the youth who are listening in, who probably are not being able to discuss their issues with their families?
We've used this earlier, and I'll say this again: unmute yourself. Something that Chetty, you and I have talked about over the past several years, and I'm very grateful to India today that you continue to focus upon mental health. Very, very, very grateful here. And unmute yourself, young people. Unmute from 2 sides. Unmute when you have a problem, don't hesitate, talk about it. And when somebody talks to you, unmute your compassion and responsibility. Let's unmute ourselves.
That's a very good message going on. Dr. Garg, to you about all these social media posts, and yes, the youth listening in will put it out, but also one more caveat comes with that. There are many unqualified mental health care practitioners making rounds as well, and you sometimes tend to fall into their traps as well. So how do you differentiate between the right person you find on social media or on the internet in terms of seeking help from that person? Because there are many who are not qualified to help you deal with it.
So I think for this, you said it yourself, it should be a qualified mental health professional if you are seeking help. And like Dr. Parekh mentioned earlier, our Act, the Mental Health Care Act, has taken the right step. It has defined all the mental health professionals, be it a psychiatrist, a clinical psychologist, a psychiatric social worker, a mental health nurse. So look at the qualifications of the mental health professional. If that qualification is eligible to be called as a mental health professional, then that person is skilled enough to provide you the appropriate and proper help.
And Dr. Parekh, your message going out to parents for their children, and how should their attitude towards their children and themselves also, sometimes parents themselves are unable to cope and unable to help their children. What do you have to tell parents today, young parents, older parents who are listening in?
Couple of things. I think, remember, you're a role model. Whether you like it or not, children are looking at you. So what you do, what you say is going to be expressed by your children as well. The other aspect is, I think parenting is also a lot about learning on the job and not imposing. So you should remember what your role is. Be a facilitator, someone who helps the growth of an individual into becoming who they want to become. Don't allow yourself to be pressurized into pressurizing them on conformity, on comparison, on results and performance. There's a lot more to life, and life is about overall development, and your focus as parents need to be life skills. And if there is only one benchmark that matters, is your child happy?
And about taking the entire family sometimes for counseling if things are going wrong. We still don't see that happen. Families shy away from it, and many families, for whatever reason, dysfunctional families, they often require that counseling. They often require a practitioner to intervene sometimes to just bring them back together, and that people are still shying away from. So what do you have to tell them?
Whether it is individuals, couples, employees, whether it is families, there is a lot of stigma that prevents us. The reason that most of us feel, will I be blamed? Will it have a negative impact on my life? How will I be looked at? Will I be mocked? So on and so forth. And we need to ensure that our milieu does not allow this messaging to reach individuals, because that's the single reason why people don't seek help. The moment we remove that, we'll see more and more people talking about it. So when a family would hear some other family going to, let's say, for counseling to, let's say, Dr. Bhavu Garg, and benefiting and talking about it, more will be able to go. I think that's the kind of approach we need to have. And that's why I said our strength lies in our community resources. Focus needs to be at school, college, corporate level, and what RWS can do. Because when you have a community already existent, a structure there, it's much easier to implement change.
Yeah, and I also want to tell our viewers that there's something called as doctor-patient confidentiality as well. So whatever you tell your doctor, your psychiatrist, your counselor, whoever your mental health care practitioner is, it remains between you and the doctor and does not get leaked out ever. So don't feel that you're being judged. Don't feel that it's going to get leaked. Don't feel people are going to mock you. Don't feel that what are people going to think about this. Go ahead and speak to your doctor. And before we let you go, one last question from Dr. Garg before we wind up this broadcast. Your message to employers out there, because that's the shift we still require to see in our country. What do you have to tell employers?
I think carrying on from what Dr. Parekh said, that unmute yourself. So employers, parents, everyone, I think start listening. So be the listeners, provide the enabling environment, enable your employees to talk about mental health issues, provide them the access to services, and one thing you said, that be non-judgmental. So if you are able to do these things, I think we can tackle the mental health issues in the workplace as well.
Let me add one thing to what Bhavuk said, Chaiti here.
Yes,
One thing that organizations can do, you measure your profit and loss in EBITDAs. How about measuring mental health outcomes at the end of the year, every year?
Oh, wow.
What was the mental health outcome of 1 year of working in your organization? Add that one thing and you will see a change happen.
I'm just emailing my HR right now after this broadcast. I'm going to say this is what happened in the broadcast. Let's start right away. But really, this is great. I mean, employers need to take cognizance, and just like the way you have your P&Ls, why don't HRs of all the organization also evaluate mental health outcomes of their employees? The workplaces are going to be far more happier, nicer, better ecosystem, less toxic to really work with. So what a fantastic suggestion, and let's end that on that fantastic note. Dr. Parekh, Dr. Garg, thank you so much for joining us on this important discussion.
Thank you.
Thank you.